Inflammation is often the root cause of many diseases. But the tricky part is figuring out what type of inflammation it is, how to identify it, and most importantly, how to prevent it, because most of us, if not all, tend to follow a good lifestyle. Or maybe we think we do. So let's look at an example to one of my meals. I tend to eat a 10 ounce of yak steak, 3 free-range eggs, and sometimes an added 4 ounce of blue cheese. Now this meal contains a lot of protein and fat with a total of 92 grams of protein and 33 grams of fat. So after eating this, it's important to pay attention to how you feel. Blue cheese, for instance, can be high in sodium and contains histamines, which are produced during the fermentation process. So if you're sensitive to histamines, you might experience headaches, digestive issues, skin rashes, or other unpleasant reactions within 30 minutes to a few hours after eating. And these symptoms can last up to 1 to 2 days depending on the person. So this is an inflammation issue. So imagine you are following my eating habits or possibly similar, and every time you consume blue cheese, you are activating an inflammatory factor for 1 to 2 days. Now keep in mind guys, I'm only focusing on heart disease in this video. So histamine, as an example, itself does not directly cause heart disease, but it can contribute to inflammation in the body, which is a risk factor for heart disease. And here's how it plays a role. Guys, don't forget to subscribe and like to support my channel if you don't mind. So histamine is a compound released by immune cells during allergic reaction and inflammation. When you consume foods high in histamine or histamine releasing compounds such as aged cheeses, fermented foods, or even alcohol, it can trigger inflammatory response in some people. Now, chronic inflammation over time can damage the lining of your blood vessels, endothelial dysfunction, which is an early step in the development of atherosclerosis and heart disease. In addition, some studies suggest that people with a condition called histamine intolerance may have a much higher risk of developing cardiovascular problems due to the chronic inflammation caused by their heightened sensitivity to histamine. But it's important to note that histamine is just one of many factors that can contribute to inflammation and heart disease risk. Other important factors will cause issues. So to help prevent these risks, it's essential to be in tune with your body and pay attention to any symptoms you might experience after eating certain foods. Don't just brush it off as a sign of getting older like some doctors might say. And there are several biomarkers of inflammation that you can get tested at a standard laboratory to help assess your risk of heart disease. These include C-Reactive protein, interleukin-6, tumor necrosis factor alpha, fibrinogen, erythrocyte sedimentation rate, white blood cells count, homocysteine, myeloperoxidase, and lipoprotein-associated phospholipase A2. It's a good idea to keep a diary of your symptoms and compare them to your test result for a more accurate picture of your health. This way, you're able to pinpoint which foods could be causing inflammation. So let's say, based on the information I shared in this video, you suspect that you might have a histamine issue. And now, you're dealing with inflammation that lasts for 1 to 2 days after consuming certain foods. So what can you do to help manage this situation? Number 1, of course, you can always stop the consumption of blue or aged cheeses, or you can add DAO, stands for diamine oxidase, which is naturally produced in the intestinal lining and is actually responsible for degrading histamine and other biogenic amines ingested through food. 2, consider adding 1 teaspoon of DHA, which is an omega-3 fatty acid, to your daily routine. And omega-3s are known for their anti-inflammatory properties and can help support heart health. 3, try taking 1000 milligrams of nano-curcumin, a highly bioavailable form of curcumin. This powerful compound found in turmeric has a very strong anti-inflammatory effect. 4. Incorporate quercetin into your diet or supplement regimen. It's a flavonoid with both actually anti-inflammatory and antihistamine properties, making it a great choice for managing histamine released issues. 5. Boost your intake of vitamin C either through food sources or supplements. Vitamin C is a potent antioxidant that supports immune function and helps reduce inflammation in the body. 6. Consider using magnesium ionic chloride to help relax your blood vessels. This form of magnesium is easily absorbed and it can contribute to better cardiovascular health and reduction of inflammation. One last thing to share with you, did you know that most powerful and well-researched anti-inflammatory supplement out there is actually nano curcumin? The thing is, it's only available in a special form called liposomal, which means it's actually encased in tiny fat particles. And this is important because regular curcumin powder has a really low absorption rate in the body, which is why many people don't feel any difference when they take it. So if you're considering taking curcumin for its anti-inflammatory benefits, just make sure to look for the nano curcumin liposomal form to get the most out of it. And it is always a good idea to add a second supplement, as you will provide a synergistic effect targeting inflammation through multiple pathways. So you know how I mentioned keeping a food diary and writing down any symptoms you experience? Well, the whole point of doing that is to help you figure out which foods might be triggering your histamine issues. And by keeping track of what you eat and how you feel afterwards, you can actually start to see patterns and identify the culprit. See, the cool thing is, once you know which foods are causing problems, you can simply cut them out of your diet. This way, you might not even need to take any extra supplements to manage your symptoms. It's like becoming your own detective and solving the mystery of your histamine intolerance. Now, I get that sometimes you might have social events or gatherings where it's tough to avoid certain foods. In those cases, having some emergency supplements on hand can be a good backup plan. You can pop one before the meal just to give yourself a little extra protection, let's say against any histamine overload. But overall, the key is to listen to your body and make adjustments to your diet based on what works best for you. By taking control of what you eat and being mindful of your triggers, you can hopefully keep your histamine issues in check without having to rely too heavily on supplements. And it's all about finding the balance and doing what feels right for you.